Welcome to the IMP Estape TrenMAX in-service video. Take the contents of the TrenMAX positioner out of the package. Place the green arm straps to the side. They will be used later after the patient is on the table. Unfold the security straps to each side of the table. Position the TrenMAX centered on the table and approximately 1 hand width above the perineal cutout of the OR table. This will leave enough side rail to later attach the stirrups. Thread the straps of the TrenMAX through the side rails of the table. While keeping the pad centered on the table, gently attach the straps on the first side. Once the straps on the other side of the table have been secured, you can firmly secure the straps to the opposite side. The tighter you secure the straps, the better the TrenMAX will perform. The TrenMAX clamp has a hinging bottom jaw. This is a proprietary design clamp that secures the straps of the TrenMAX to the side rail of the table. Slip the clamp around the straps of the TrenMAX, then push the clamp down, allowing the bottom hinge jaws to lock to the table. Then lock the knob. Repeat this step on the opposite end of the TrenMAX. Cover the TrenMAX with a patient draw sheet. As pictured, some facilities prefer to leave the 2 clamps off of the patient transfer side to allow the transfer table to get as close as possible to the OR table. Then attach the remaining 2 clamps once the patient is on the table. After administering anesthesia, use the draw sheet to slide the patient down to the perineal cutout of the OR table and remove the draw sheet. Use the standard OR protocol for putting the patient in stirrups and lowering the end of the table. Slightly roll the patient's shoulder and remove 1/2 of the soft protective cover. Repeat this step for the other side of the patient. Now that the patient is stuck to the sticky pad of the TrenMAX, secure their arms. Attach the green strap to the top Velcro strip. Wrap around the patient's elbow, then tuck the remainder of the strap under the patient's arm until it sticks to the bottom strip of Velcro. Repeat this step as low on the patient's arm and as close to the wrist as possible. You are now ready to put the patient into Trendelenburg. At the end of the procedure, cutting the green arm straps is the easiest way to release the patient from the TrenMAX. You can use a patient transfer board to move the patient off of the TrenMAX and OR table, or disconnect the white straps of the TrenMAX from the side rail and use the TrenMAX itself to transfer the patient. If you would like more information, a trial, or an in-service on the IMP Estape TrenMAX, please use the information on this screen.